Are all breast cancers hereditary? I know this is a question I always get in my clinical practice. A lot of women come and ask me, hey doc, my mom has breast cancer. Do you think I will get it? To understand that, we need to figure out whether mom got the breast cancer because of hereditary reasons. So know that all cancers are genetic, but only some cancers are inherited or hereditary. So 100 out of 100 cancers are genetic, because cancer is ultimately a genetic disease. It is when mutations, changes happening inside your body in the DNA, that's when you have cancer. But the change can happen because of several reasons. It can happen if you smoke cigarettes. It can happen if you got radiation in Chernobyl nuclear disaster. It can happen if you overate sugars, became obese. So various environmental exposures can cause changes in the genes. So all cancers are genetic. So some of these exposures can cause mutations. But there is about 1 in 10 cancers, changes in the gene get passed on from mother to child, from grandmother to mother to child, from aunt to sister to child to niece. You get the point. So some cancers are hereditary or inherited. All cancers are genetic, but only some cancers are hereditary or inherited. So just because your family had somebody with breast cancer doesn't mean that you're going to get breast cancer. It depends on why that woman in your life got breast cancer, your mother or your sister. If that person got it from their genes, in which case there would be a clear pattern of cancers in the family. For example, a patient who comes to me today would say, I'm 50 years old, I have breast cancer, my mother had ovarian cancer, my cousin, that's my mother's brother's daughter, had breast cancer, my aunt had something going on in the abdomen, it's probably a cancer, I don't know. So there is a pattern. If there is a pattern like that, then it is possible that your mother had breast cancer because of hereditary genes, because of hereditary reasons. In that case, it is very important that you know why that cancer came, because then you can decide if you can undergo certain tests, some screening tests, so that you can prevent cancer from hitting you. Currently, we have genetic tests available. All you got to do is take some blood from the patient in your family who has the cancer, breast or ovary cancer for instance, send it for genetic testing, and after about 21 days you get the result, and it will say if that person got the cancer because of an inherited reason. If that's the case, there are certain things that you can do if you have a blood relation with the same person, and that is one, you can choose to get MRI screening every year or mammogram screening every 6 months, or you could choose to remove your breast like the famous film actor Angelina Jolie did, because she knew she had a hereditary breast cancer. She just decided to remove her breast before even it got the cancer, because she knew she was going to get the cancer in the next 10 years or 15 years or 20 years. So she just decided to remove it and have implants placed instead. So there are breast implants, silicone implants you can place that looks like breast. From the outside you wouldn't know that a person doesn't have breast. So she just chose to do that. And Angelina Jolie is another example because she also took out her ovaries. So because the person who has a risk for breast cancer could also get an ovary cancer, and there is no way to screen for ovary cancer. Like for breast you can do MRI, mammogram, ultrasound. There is nothing you can do to screen for an ovary cancer. The only thing is you remove the ovaries ahead of time. So what I would say is, if your family member has had breast cancer and there is a strong family history, strong link of family members having cancers, then you could have one of the family member test for an inherited reason for breast cancer or ovary cancer. If that person has the cancer because it got passed in the gene, then you can do certain things to take care of yourself. One is you can choose to get your breast removed or get screened. You can choose to complete your family by the time you're 35 years of age, that is, get married, have children, and by 35 or by 40, you don't need your ovaries, and just prophylactically, preventively remove the ovaries. That way you can save your life. So again, being aware, being informed can save your life, can save your relatives' lives. So be informed.